Welcome back to our series, All You Need to Know About Cancer Biomarker Testing.
I'm Sophia, a journalist. Today we're exploring lung cancer and how biomarker testing helps in diagnosis and guiding treatment. Joining me is Dr. Anna, a pulmonologist, to explain more.
Thank you, Sophia. Receiving a lung cancer diagnosis can be overwhelming. I'm here to explain the basics clearly and simply so patients and their families can feel more informed, confident, and supported.
Let's start with the basics. What is lung cancer?
Lung cancer occurs when cells in the lungs grow out of control and form a mass called a primary tumor. As the disease progresses, it can spread to other parts of the body through a process called metastasis, most frequently affecting the brain, liver, lymph nodes, bones, and adrenal glands.
Are all lung cancers the same?
No, there are different types of lung cancer. The most common type is non-small cell lung cancer, which includes several subtypes and can grow at different rates. Small cell lung cancer is less common but spreads faster. There are also some rare types.
What causes lung cancer?
Smoking is the main cause, with approximately 85% of cases linked to tobacco use, making it the most avoidable risk factor for developing lung cancer.
Are there any other risk factors for lung cancer?
Yes, secondhand smoke, air pollution, radon gas, and asbestos can increase risk, even in people who have never smoked. In fact, just having lungs means everyone has some risk.
Can lung cancer be hereditary?
Hereditary lung cancer is rare and not well understood. Having two or more close relatives, like a parent or grandparent with lung cancer, may suggest a genetic predisposition.
How can lung cancer be detected?
Detecting lung cancer is not easy. Most patients are diagnosed after symptoms appear, such as persistent cough, coughing blood, chest pain, shortness of breath, hoarseness, fatigue, or weight loss. Because these symptoms can be mistaken for other conditions, diagnosis often comes late. That's why if the symptoms persist, an imaging test such as CT scans should be performed to help detect lung cancer as early as possible.
Are there any screening tests recommended to help detect lung cancer at an earlier stage?
For people who smoke or have a long history of smoking, low-dose CT scans can detect lung cancer before symptoms appear, greatly improving the chances of successful treatment.
What happens after a lung cancer diagnosis?
The next step is staging, which tells us how large the cancer is and if it has spread to other parts of the body. In stage 1, it's limited to the lung. In stage 2, it may have reached nearby lymph nodes. And in stage 3, the tumor may be larger and may have spread to nearby lymph nodes inside the chest. By stage 4, the cancer may have spread to other parts of the body.
How is lung cancer treated at each stage, and what diagnostic tests guide treatment?
Early-stage lung cancer is often treated with surgery and may also include additional therapies such as targeted therapy, for example, EGFR or ALK inhibitors for non-small cell lung cancer, immunotherapy, chemotherapy, or radiation therapy. In advanced stages, clinical guidelines recommend analyzing a tissue biopsy with an NGS panel that assesses more than 10 genetic biomarkers, along with immunohistochemistry testing for the protein biomarker PD-L1. These analyses help determine the most appropriate treatment, with results typically available within about 2 weeks.
What happens if a genetic biomarker is detected in the tumor biopsy?
If a genetic biomarker with a targeted therapy is found, treatment is usually a daily pill at home, offering better disease control with fewer side effects and helping maintain quality of life.
What happens if PD-L1 is positive?
PD-L1 positivity means there is a high chance that immunotherapy will work. It is given in the hospital via regular infusions and usually causes some side effects.
What if both genetic biomarkers and the protein biomarker PD-L1 are negative?
When both are negative, treatment usually involves chemotherapy combined with immunotherapy. These treatments may cause side effects.
What can be done if standard treatments stop working?
For patients who have finished standard treatments or whose cancer isn't responding, clinical trials can provide access to new therapies. It is important for patients to discuss with their doctor whether a clinical trial might be suitable for them.
Now I understand how biomarker testing helps define diagnosis, inform prognosis, prevent unnecessary side effects, and guide the optimal therapy for each patient. But which types of biopsies are used for biomarker testing?
The most common type is a tissue biopsy, which involves taking a small sample directly from the tumor. It is usually performed in a hospital and is considered invasive. Biomarker testing can also be done using different body fluids, a technique known as liquid biopsy. The most common fluid sample is a simple blood draw, which is less invasive than a tissue biopsy.
Dr. Anna, when should tissue or liquid biopsies be used?
A tissue biopsy is the gold standard. When collected, it can reveal key biomarkers that confirm the diagnosis and help choose the optimal treatment. A liquid biopsy is a valuable option in advanced or relapsed cancer, as it can detect biomarkers like EGFR or ERBB2 from both primary and metastatic sites, which a tissue biopsy taken from a single site might miss, helping to personalize treatment. In addition, a liquid biopsy can serve as an alternative if the tissue sample is too small or the quality is low. It's also useful when the tissue is difficult to access.
That's very interesting. Can a liquid biopsy also be used in early-stage cancer?
Liquid biopsy is also being developed for early-stage cancer to detect minimal residual disease, which refers to small amounts of cancer that remain after treatment. This approach could help doctors identify a relapse before it becomes visible on scans.
What are the most important things to know about lung cancer and biomarker testing?
Lung cancer is one of the most common cancers worldwide. Symptoms like persistent cough, chest pain, or coughing up blood should not be ignored, irrespective of smoking history. Biomarker testing is key in lung cancer to personalised treatment. Rapid turnaround time facilitates optimal and timely treatment decisions. Tissue biopsy is the gold standard. When tissue is unavailable, difficult to access, or the cancer is advanced or has relapsed, liquid biopsy is a useful alternative and may, in the future, detect minimal residual disease in early stages. If you or a loved one is diagnosed with lung cancer, ask your doctor about biomarker testing, as it can make a significant difference.
Thank you, Dr. Anna, for the insightful discussion on lung cancer and biomarker testing. It provided valuable information for exciting new material in our Oncology Daily Journal.
If you want to see the full video series on all you need to know about cancer biomarker testing, scan the QR code. If you found this video useful, please like, share and subscribe for more episodes in our series. Take care and stay informed. This video is for educational purposes only. If you have any questions, please speak with your doctor.